Hello, I'm Dr. Brian Ott from Op Family Chiropractic, and I'm very excited to introduce you to two of our new exercise specialists who have been very integral in how we have been able to change really our patient care. So we have Zach Dykes here, and we also have Amber Moyer here, and they've been integral in our ability to help our patients with the exercises that they really need to help get them better, along with my adjustments and Dr. Sophie Mills' adjustments as well too. So we wanted to explain a little bit more what Reflex Performance Reset is and why we use it in our clinic and how it's really benefited our patients and our ability to help our patients reach their goals and optimize their life just in general.
So what is it exactly you're doing?
So what RPR does is it takes your body from a stress state, a sympathetic state, to a parasympathetic state. So basically it allows your body to fall back to the proper firing patterns with your muscles, using them the way they're supposed to be used. And the problem is that over time we develop compensatory patterns, negative patterns that we don't want in our body. So RPR just helps get our body back to those correct patterns. And it's something you can do on your own.
How long does it take to learn how to do it, if I were to do it by myself?
RPR, the full reset that you can do on yourself, it should take you probably around 10 to 15 minutes your first time doing it to do a full reset on yourself. Ideally, it'll probably take you 3 to 5 minutes once you learn all the patterning, and then it is actually implemented as far as a warm-up for a lot of D1 and professional level athletes.
But when you come into the clinic, we'll teach you 2 or 3 of the different spots at a time so that patients can just memorize them so that they don't have to look at the sheet that we give them. But then over the course of your treatment here, you'll be able to do all of them by the time you're done.
So what we're really trying to do is people start to develop improper movements and compensation. They'll use a different muscle than what it's intended use for, or overwork that muscle. One of the common patterns we see is somebody who sits at a desk. It's very common now for people to sit 7 to 8 hours at a desk and do their work. And so what I've seen in clinic over the last 16 years is they get tighter and weaker through their hip flexors, and so they start using their low back muscles rather than their glutes, because their muscles in their butt aren't needed anymore because they're sitting on them. They're basically a couple of pillows. So we need to get that pattern to actually break up, and then RPR definitely helps so that we can then give them exercises to fire those muscles in those butt cheeks to actually start to turn on again. Without this RPR, it's very, very difficult for those patients to be able to do those types of things without this. So that's why it allows us to get them better quicker and much more effectively at this point in time.
I think it's great to see patients come in and I don't even have to ask them if they did their RPR anymore, because they're like, I can't get through my day, sometimes unless I'm doing it right away when I wake up, or I'm at my desk and I realize, I feel really tight or something, and they're able to be more self-aware of how their body should feel versus how it's feeling in that moment. So they'll do RPR, or they'll do the stretches or different things that we're showing them when they're in their exercise with Zach and I. So that's really great to see them knowing that about themselves.
It seems like magic.
Yep, witchcraft. Yep.
Yeah.
Yep.
Witchcraft's the appropriate term.
Yeah.
Austin calls it the force.
Right.
He's like, teach me the force.
It really is our bodies just like Zach has talked about, priming the body for whatever we're going to have to do through that day. And then, like Amber said, if they're sitting at their desk and they get into a stressful situation, they can rely on this to help relax those muscles, whether it's through the jaw, through their breathing aspect, because breathing really has been lost in all of our aspect of society, especially when we sit at a desk and we can't take a deep breath in. And with 75 to 90% of all doctors' visits really being tied to some kind of stressful situation. It's not stress of being chased by an animal back in the day. Now it's it's having more to do with family, work, sitting in traffic, like Zach said, and all those things. So it definitely is a way for them to de-stress their nervous system So that's really why they hold their adjustments longer then, because stress will cause the misalignment that often occurs, and the reason they're coming in for that so often, so.
I guess personally on an RPR note, as far as I blew up my ACL about a year ago and I've been walking a little bit differently since then, but since I've been doing RPR interventions, I noticed that I'm able to do more and my legs are of equal strength. I'm feeling the same sensation on both legs, not just my left leg. So that's personally for me, I noticed that I've been stronger and working out better just from doing that and changing nothing else out about my routines. So.